The day hadn't started yet, and yet there were, I would estimate, 12 to 15 ambulances waiting outside.
Lisa Jane Hinckley has cancer. Her thyroid operation was urgent, but this isn't how she or her husband Liam imagined it. On Wednesday, she waited 8 hours inside the Gloucester Royal Hospital without food or water. Her private consultations taking place in a public corridor. The rooms around her bursting with patients using broken toilets. The hospital has apologised to Lisa Jane, saying they're facing unprecedented circumstances and extraordinary levels of demand.
We are in a crisis in the NHS, and to now suddenly be faced with being a patient in that environment is really worrying and stressful. It was awful for us, or for Lisa as a patient, but, she gets patched up, comes home, but these people are having to work in that environment day in, day out.
It's these conditions that have prompted NHS strikes, this and more pay, as staff tackle a triple-demic of flu, COVID and emergency department pressures. The Royal College of Nurses says it's willing to reduce its demands, and the Prime Minister says he's willing to talk.
We incredibly value the important work that our public sector workers do, especially our nurses, and we want to have an honest, grown-up conversation about what's affordable, what's responsible for the country.
In just a few days' time, ambulance workers will walk out. More pressure on a system facing a record number of ambulance waits. And while both sides have shown a willingness to talk, their positions remain the same. Sky News understands the Health Secretary has invited members of the NHS Staff Council to discuss next year's pay review body pay increases. But some striking unions are reluctant unless they can discuss their ongoing disputes. It's prompted many to ask if the NHS can cope with surging infections, record demand and industrial action.
We are working closely with the unions to ensure that we maintain the highest possible quality of care during those days of action and, of course, keep patients safe. But, of course, there will be disruption. I can't deny that.
And that means other families in Lisa Jane and Liam's position could see their operations cancelled and their health put at risk. Ashish, Joshi, Sky News.